Do you know how many pulse sites are there in our body? The answer might surprise you. There are 10 pulse sites that medical professionals routinely check. These pulse sites tell us a lot about our body's health, and each one has its unique importance. First, we have the temporal pulse. Found on the temples of the head, this pulse site is often used when other sites are not accessible. It's also the pulse site of choice when checking the pulse of infants and small children. Next, we have the carotid pulse. Located on either side of the neck, this pulse site is vital for assessing the heart's rhythm and strength. It's also the go-to site for emergency personnel when other sites are not providing a clear reading. The third pulse site is the brachial pulse. You can find this on the inside of the elbow. It's a key site for measuring blood pressure and is also used to assess the pulse in infants. The radial pulse, located on the thumb side of the wrist, is perhaps the most commonly checked pulse site. It's easy to access and provides a quick and accurate reading of the heart rate. Moving down, we have the femoral pulse, found in the groin area. This pulse site is crucial in trauma situations when a radial pulse can't be detected. The popliteal pulse, located behind the knee, can be a bit tricky to find but is essential in diagnosing peripheral arterial disease. Next, we have the posterior tibial pulse. Located on the inside of the ankle, it's used to assess the status of circulation to the foot. The dorsalis pedis pulse, found on the top of the foot, is also used to evaluate circulation to the foot. Both the posterior tibial and dorsalis pedis pulses are essential in diagnosing peripheral vascular disease. The ninth pulse site is the apical pulse, located on the chest, just below the left nipple. This pulse site is often used in infants and children, but can also be used in adults to assess heart function. Lastly, we have the ulnar pulse, located on the little finger side of the wrist. This is less commonly used but can be helpful if the radial pulse is not accessible. So, to recap, the 10 pulse sites in our body are the temporal, carotid, brachial, radial, femoral, popliteal, posterior tibial, dorsalis pedis, apical and ulnar pulses. Each pulse site plays a crucial role in assessing our health, from heart rhythm and strength to circulation status. They are our body's way of communicating its health status, and understanding them is a key skill for anyone in the medical field. Knowledge of these pulse sites enables accurate and effective patient assessment, ensuring the best possible care. Remember, knowing where to look and what to look for can make all the difference in a critical situation.